Good afternoon, everyone. I am Dr. O. I am here to present to you Coping with Grief. I am from the organization Human Service Consultants. So, what exactly is grief? Grief is an array of things that we experience, our thoughts, feelings, and behaviors that are related to the loss of someone or something. For example, we can experience grief due to the loss of a loved one, the loss of a job, or the loss of a car. And it could be due to repossession or an accident. Whatever the reason, the person may experience grief. We have different types of grief. Acute grief can last up to 6 months or more. And if it does last beyond 6 months, the therapist will change the diagnosis to major depression or persistent and complex bereavement disorder. So, we can recognize the symptoms of grief as feelings of shock or numbness, intense distress occurring in waves of 20 to 60 minutes, that often occurs with physical and emotional discomfort, like a shortness of breath or a tightness in the throat, sleep difficulties, loss of appetite, restlessness, loss of sex drive, guilt that is associated with the loss of the loved one, poor concentration, and intense sadness. The reference for this information is Therapist Aid. So once the person have moved from acute grief, they move into the stage of integrated grief. This is when we go back to our normal activities as we adjust to the pain of losing our loved one. So what we do is learn to assimilate the loss of our loved one and the memories of them into our lives. Sometimes, especially during the holidays and anniversaries and special events, we will fall back to acute grief. I want you to understand that this is a normal process. Now, what is not normal is when the person cannot move from acute grief into integrated grief. When they do not move successfully from acute grief to integrated grief, they will move into what we call complicated grief. This is grief that lasts for years and years, and the memories are deeply painful and debilitating. The person or the mourner feel that if they enjoy their own life, it's a betrayal to the loved one. So, what leads to this complicated grief? What are the risk factors? The death of a loved one was due to violence or occurred suddenly, such as a heart attack or stroke. The loved one was too young, like a child, or died in early adulthood. We tend to think that people are going to be here until they're elderly. Of course, we know that that is not a true fact. People can leave us in early age. So when the person is too young, then this complicates the grief. Or, for example, if there's no support available to the individual who is experiencing the loss of a loved one, sometimes the mental illness, which the person may or may not know about, can complicate the grief, or substance abuse, like drinking alcohol, taking prescription medications, enjoying cocaine, indulging in heroin use. These are the things that can also interfere with the healing process. So what can we do to cope with grief? Task 1, we have to accept the loss. We cannot stay in denial. Denial in the beginning is accepted and expected because it takes the psyche, the mind, time to adjust. So those first days of learning of the death of a loved one, when we're walking around in the haze and we're saying, no, 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 this didn't happen, especially if it's a violent type of incident. And we're saying, no, no, this didn't happen. Actually, it's our mind being protected, because the mind is a very, very intelligent instrument. And when it's in danger of not being protected, it will go into denial. That's a normal process and is expected the first day, but we can't stay in denial. We have to learn how to, task number 2, process the pain. Then we have to learn to adjust to life without the loved one, which is difficult for some people. In the beginning, it's difficult for all of us because we love that person and we don't want to see life without that individual. But it's a reality. It's the human condition that we can't stay here. We have to leave. And so we have to learn to adjust to life without the loved one. What we can do, and it's just really a way of making us feel better, is to memorialize the loved one in whatever way you deem necessary for you. It could be a plaque. It could be a memorial garden. It could be a statue. It could be poetry. Any way that will help you to feel better and adjust to the situation. Memorialize the loved one. I remember when we had the first years of HIV and AIDS, and we were losing people rapidly to AIDS. What we did, well, I actually went to view the memorial quilt. But people across America, what they did is they developed a quilt. This was a way to keep the loved one alive in memory. Also, what you can do, and this is something that didn't actually come through Therapist Aid. This is something that I added. Therapist Aid gave us tasks 1 through 4. I am adding task 5. What I would like you to learn to do is to redirect your energy to bring happiness to others. Because what I've learned in the process of grieving and moving past my grief is to do for others. This will bring happiness to you. People are beautiful. What we have learned in psychology is that people are basically good and evil. I like to bring out the good in people. So the happiness that I bring to others, also helped me. Because as you can imagine, as a therapist, I hear all types of situations. And sometimes these situations aren't so pleasing to my ear. And I need to be able to process the information, move forward so I can continue the work that God put me here to do. And so I have learned that bringing happiness to others bring happiness to me. Here is your assignment. This is a way of getting your feelings out in regards to the loss of a loved one. Write a letter to that person and say all the things you want to say. Say those things that you didn't have a chance to say. Say those things that you want to say because of what's going on in your life today, and you want to share it with that person. You can keep this information in a diary, a journal, in a jar, under your mattress, under your pillow, wherever you deem that's going to bring you some type of peace and happiness. Because guess what? Your loved one do not want you here unhappy. That person loved you. You know that that person loved you. That's why you're still grieving. But guess what? When we love unselfishly. So that person doesn't want you here being unhappy. Learn to live life to its fullest. Well, that's all I have to say. And once again, I am Dr. O. I am a licensed mental health and substance abuse therapist. I am a university professor teaching in the areas of psychology and addiction counseling. I am the owner of Human Service Consultants. I am the founder of Serene Living Incorporated. And always, you know how I end my presentations. Love always and keep it moving. Have a blessed day.